So tonight we begin with medical humanities. Now, under this course, basically, when you are trying to define naturopathy, there's an aspect of naturopathy that you have to highlight. It's the holistic system of healing. And when we talk about holistic, it means that you are looking at the whole person and not the disease. In fact, one of the take home I have been carrying with me everywhere I go when I came to read naturopathy is that naturopathy doesn't treat the disease, but you treat the person. Because it is the person who is not well. When you treat the person and because there's disharmony in this person, when the disharmony is reversed and harmony is restored, then the disease will just leave the person. So holistic medicine is anchored on the fact that the human being is made up of several parts. We have the spiritual part, we have the physical part, we have the emotional part, we have the mental part, we have the social part. Okay, and other aspect even says that we also have the financial part of the person. Okay, so there are so many aspects that put together makes up a person. Okay, great. So even if you look at how WHO defines health, it says that it's a state. Okay, it's a state of a person. Okay, that talks about the social health, the physical health, the emotional health, or the mental health. Okay, and not just about the absence of a disease. So even WHO recognizes that a person is not just the body we see, but it's made up of other aspects. Okay, the reason why I have to bring in this statement is that medical humanities is an aspect of medicine that is going to focus on some aspect of the person. That is about, we're going to look at the mental or the emotional aspect of the person. And that is what medical humanities is about. Okay, we are going to look at the emotional aspect or the mental aspect of the person, where we are also going to treat this aspect, okay, to bring about optimal health or holistic healing. So medical humanities is going to focus on that aspect of the person. Basically, that is what medical humanities is going to address. Okay, so under medical humanities, that is within the 4 months period we are going to engage you. By the end of this semester, all of us here, we should be able to demonstrate our knowledge of introduction to psychology. Okay, we are also going to demonstrate. When you say demonstrate, we are going to show. You should be able to speak. You should be able to express yourself about how what psychology is about, and then your knowledge of clinical reasoning and critical thinking. Okay, we're also going to demonstrate knowledge of social context and health disparities, and then you're also going to demonstrate knowledge of humanism in health and healthcare. So we are going to deal with these 4 areas before the semester ends. Okay, don't worry, the slides will be shared. It will be given to the course coordinator, and then she will share it on the page. Okay, so please, so if you want to read ahead, you should know something about psychology, clinical reasoning and critical thinking, social context and health disparities, humanism in health and healthcare. So you can, those of us who want to go ahead of the class, you can take it read it, prepare yourself before you come to class. Okay. All right. So I just explained to you what is holistic medicine. So holistic medicine doesn't treat disease or symptoms, it treats the person. And I also said that the person is made up of different aspects: the emotions, the mental aspects, the physical, the spiritual, the social aspects, and then we can also go beyond the financial aspects. And all these aspects together, if you're able to treat a person in this way, we say that you have achieved holistic therapy or holistic medicine. All right. So as I spoke about, it talks about treating the whole person, body, mind, emotion, and spirits. So rather than just focus on the specific symptoms or disease, aiming to achieve overall well-being and balance through lifestyle changes, traditional practice, example, blah, 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 and then complementary therapies alongside conventional medicine. Okay, so that is what holistic medicine is about. So yes, so physical, emotional, mental, social, and spiritual factors of a person. Okay, so as I said, under medical humanities, we are going to look at the emotional aspect of the person, the mental or the mind aspect, and then the social aspects of the person. Okay, that is what medical humanities we are going to focus on. All right, good. So we are looking at what at all is this humanities. Dr. Ross is now disturbing us with it, or Nyakote is now going to confuse us with this medical humanity. What are humanity? In fact, if you go to the university, in fact, there are some category of courses that are grouped under humanities. Okay, so the word humanities come from the Latin word humanitas, which means human nature or human quality, or what makes a person a human. Okay, that's about humanities. So in the ancient times, this subject or the study of human nature were subjects that were considered essential for a free and educated person to learn, such as grammar, rhetoric, poetry, and history. These were contrasted with a subject that were useful for practical purposes, such as law, medicine, and engineering. What this statement is trying to say is that people who were learning law, medicine, and engineering, they were also made to study humanities, because humanities talks about how the human being behave, about human nature, okay, and how to study. So if you're a lawyer, you need to know why human beings behave the way they behave. If you're a doctor, which some of us want to aspire to become, you need to understand why human beings behave the way they behave, and some of the disease that affect us because of the way we behave and think. Okay, that's about humanity. So in academia, humanities is a term that refers to a wide range of academic disciplines or subjects or courses that studies the various aspects of human culture, such as literature, history, philosophy, art, religion, and languages. So humanities subjects aim to explore the values, beliefs, ideas, and expressions that shape and reflect human experience. So what they are trying to say is that there are some subjects or courses that you go to learn that makes you gives you the knowledge or the idea to understand why human beings behave the way they behave. Okay, so let me give you a typical example. You see two drivers. They were driving on the highway, and then all of a sudden, the traffic light, red, pops up, and they all apply the brakes and they stopped. Now, when less than a minute or two, the green light came on. Now, these two drivers apparently were behind two other cars in front of them. Now, When the green lights came on, the first two cars that had to move, one of them saw the green light and just applied the accelerator and moved. But the other one, we don't know what happened, was still standing there, and the car behind him started hooting the horn, shouting, insulting. Meanwhile, there were other drivers who were behind this car. They were just quiet. They were not hooting the horn. They were just quiet, waiting for the first car to move. So now the question I want to ask the whole class. Two drivers were faced with the same situation. One of them started hooting the horn, shouting, yelling. Who is that? Why do you think we'll sleep here? I mean, shouting at the driver who couldn't see the green light on time. Meanwhile, another driver too was behind the same car, was very quiet, waiting for this car to move, for him to move. Now, humanities or psychology will explain, will let you understand why that one driver started shouting, hooting the horn, but the other one was very quiet, was very patient, waiting for the other car to move. Apparently, I think after 1 or 2 minutes later, the car which couldn't move was because the car had developed a problem. So therefore, the street hawkers who were standing by had to come and help him move the car out of the way. So now, this driver who was shouting and hooting the horn realized that, oh, so your car couldn't move. That was, then I'm very sorry. So now he started to apologize. Meanwhile, the other ones who was very quiet, was still quiet. He even called the street hawkers to come and help this driver to move the car off the road so that they could all move. So the question is, why was one person shouting, yelling, hooting the horn? The other one was very empathetic, was very calm and quiet, and even called for people to come and help the other driver to move the car. So psychology will let you understand why these two people behave differently. Humanities will also help you to understand it. Okay. All right. So humanities education is not focused on training students for a specific profession, but rather on developing their critical thinking, creativity, communication, and empathy skills that can be applied to any field of endeavor. Okay. Now, I have seen where I work. I'm in the pharmacy department. I dispense medicines. I realized that when some people come to sit in front of the pharmacy, they will come and meet a queue. Some of them will wait patiently for their turn. They will be called to come and pick their medication. Some too, when they sit down for just a few minutes, they start to complain. I've been here for long. What is happening? Why is the system down? Why are not people calling us? Blah, 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 blah. I realized that most of the time, those who sit down quietly to wait for their turn, they work in other companies where they also attend to people who come to sit down and wait for their turn. Now, the reason why they're able to wait patiently is because they have encountered similar situations at their offices. So they understand what happens to people when they are in a queue. Okay. Okay. So when you study humanities, it makes you think critically. It also makes you to become empathetic. When you say empathetic, it means that you are putting yourself in the situation of the other person. That if I was the other person, how would I wish that people treat me? That is empathetic. And then communication, how to speak well. In fact, when I'm teaching my students at the introduction, this is what I always tell them. In the good books, that is the Bible, the book of Proverbs, I think chapter 22, verse 11. This is what it says. He that has a pure heart and knows how to speak well will become the friend of a king. Literally, what they're trying to say is that if you know how to speak well, or if you know how to communicate, you become the friend of prominent people or people in high places because you know how to speak. When you study psychology or humanities, you understand situations in life, and therefore you're able to communicate well. It doesn't apply to everybody. Some people have read psychology. In fact, they are called psychologists. But sometimes, as human as they are, they exhibit their human nature by communicating harshly, speaking harshly to their neighbors. That should tell you that no human being is perfect under the sun. Okay, good. So now let's go look at the other side of the name, medical humanities. So we've seen humanities. Let's look at the medical aspect. So when you say medical or medicine, it relates to the science, practice, or treatment of health, illness, or injury. Okay, so the act of treating somebody, or the practice of treating people or healing people who are sick could be called medical. Okay, and this involves everything, right from diagnosing disease, providing therapies, and promoting wellness, to the education of physicians, and the equipment used in this care can also be called medical. Okay, all right. So examples include medical examination, emergencies, research facilities like hospitals and clinic. Okay, so anything that involves diagnosing of a disease, giving of therapies, or the promotion of wellness through the use of equipment or any other means to achieve optimal health can also be called medical. Okay, so let's look at the two words put together, medical humanities. I'm taking my time to explain this because this is the foundation. If you get the foundation right, and then subsequently I start to run, you appreciate, because the foundation is very strong and very solid. Okay, so what is medical humanities? Okay, yes. So medical humanities basically means the use of arts, literature, history, and ethics to understand the human side of medicine, how illness feels, its impact on life, and how to be a more compassionate, insightful doctor, going beyond just science to see the whole person, their history, and their experience with health and suffering. What does it mean? It means that medical humanities try to understand the person who has come to your facility. When you study medical humanities, it gives you the knowledge, the skill, and the ability to know that the person who is sick and is sitting in front of you can behave in a certain way. Okay, so you trying to use literature, arts, history, and ethics to know who this person is sitting in front of you is called medical humanities. So now I'm going to make it more simpler so that you understand it well. When you say arts, literature, history, and ethics, how does somebody like you, let's say Dr. Ambrose or Dr. Kenneth Opoku, okay, or Dr. Ellis from, Dr. Lucia from Belize, how are you going to use arts, literature, history, and even ethics to understand a person? Okay, so that is what we are going to look at today. And then maybe when the time is up, I would have to bow out, because I understand 8 o'clock, I think you have medical terminologies or what. Okay, so this will not be like the way we're treating natural hair, where I had 3 hours to speak, they just 2 hours. the belief system or the lifestyle, that is the culture, the story, and what it means to be sick. I know most of you have heard some people say that, hey, how can a doctor also fall sick? In fact, I've heard this severally. Sometimes when I'm a bit under the weather and maybe I take off duty to go and rest, I'll say, hey, you that you are sitting with, among medicine, you that give out medicine, why do you also fall sick? Such people, they have not learned anything about humanities. So they have forgotten that doctors too, the air we breathe in, they also breathe same. Okay. The markets you go and buy your contombre or yam from, doctors also go to that same market to go and buy it. So if the yam you eat and fall sick is not good, when the doctor also eat the yam, you also fall sick. Okay. So medical humanities is in two folds. The person who has come, the disease or the sickness, you request for the laboratory investigation, and also the treatment. That is the medical aspect. Now, the person you are going to give the medicine to, is he afraid to take the medicine? Is he under any depression? Is he going through any emotional trauma? The family, the family background the person is coming from, do they have any chronic disease that is running through it? The belief system of this person, does he believe that, okay, does the person believe that taking medicine will cure him or her? So this aspect about the person sitting in front of you is about the humanities aspects. Okay, great. So I will conclude on this topic. That is the take home. Okay, you see the two people carrying the building away. So please, with all that I've said, if you don't remember anything, don't forget this. That is about the take home. Okay. So humanities, medical humanity is in an interdisciplinary course, or it's a subject that combines science with subjects like literature, history, philosophy, ethics, sociology, and arts. Okay. And then it also focuses on the human experience. It explores the pain the person is going through, how the person is hoping to get healed, and what it means to be a patient or a caregiver. Okay. So it also means that medical humanity also builds a better doctor. So it trains healthcare professionals to be more empathetic, culturally sensitive, and better communicators. By the time you finish with this course as a practitioner, when somebody is not well and is afraid to go through any therapy, you should be able to understand that the person is a human being. Okay? So you should be empathetic. You should also be culturally sensitive. You should know that every human being, the belief system. Some human beings don't believe in going to do exercise. Okay, per their belief system. So if the modality you want to introduce to this person involves exercise, then you should know that you have to change it, because based on the cultural background of the person, it doesn't believe in exercise. Or let's say hydrotherapy, or any of the, for instance, acupuncture. Acupuncture involves the insertion of some thin villiform needles. In their cultural setting, they don't believe in any needle. So it means that if the modality you are going to employ is acupuncture, because of medical humanities, you become culturally sensitive so that you don't apply acupuncture. You also become a better communicator. Okay, you're able to communicate very well. Okay, I've explained further, so let me move on. Okay, so why study medical humanities? Why should you study it? I think even the example I've given should be able to, help us. So when you say, why do you have to study medical humanities? One, it makes you, the practitioner, you humanizes medicine. When you say humanizes medicine, it makes you the practitioner, a human being, so that you can feel for your fellow human being. You see the doctor and the child in the picture. Now, this is a doctor, a trained doctor, but because he's very empathetic to this child, this doctor has knelt down on his knees and standing by the bed, opening his mouth for the child to also open his mouth. And I've seen a lot of doctors, when they are treating patients, it's as if they are comedians or they are artists. They will just be dramatized the whole thing. So when you learn medical humanities, it makes you put yourself in the shoes of the patient so that you behave and dramatize whatever you are doing. You become more compassionate, more patient care, or more patient-centered care. You treat your patient with dignity and respect. Okay, that is one of the importance of learning medical humanity. The second one is that it improves patient care by fostering empathy. Is, I think, the same thing. So you can see this doctor with this small boy. This is a medical doctor trained, but you see, he wants to treat this boy, so he's playing with the boy. He's dramatizing the whole thing. So when you study medical humanities, you should be able to come down to the level of your patient. Okay. Now, you see this doctor with this patient. So medical humanity, it helps practitioners to understand patient whole life, not just their disease. It leads to stronger doctor better engagement. The reason why patients will follow a particular doctor everywhere he goes is that they realize that this doctor is a human being. I can tell you, please excuse me for my word, some doctors behave as if their patients are animals and they are not human beings. But I can tell you, please, when you learn medical humanities, it makes you feel for the patient. And I can tell you, your patient will follow you everywhere you go because they want to come to you. The way you respect them, the way you talk to them, even if they are at fault or they have defaulted in their therapy, you don't scold at them, you don't shout at them, you don't yell at them. You make them feel sorry for defaulting with their therapy. Gone are the days where doctors will even shout at patients, "Who told you to go and take this medicine? Oh, so you know what is wrong with you. You have also become a doctor. Now you have become a go-go doctor. You patient no longer respect us again." No. Doctors don't talk like that. So if you know of any doctor or a practitioner who behaves like this, most of them, please pardon me, though you could correct me, most of them work in the government institutions, but they don't care whether they attend to patients or not. They know at the end of the month they are going to be paid, so they don't care. But this same doctor, if he moves to a private facility where he knows that the patient he's taking care of is the same patient who is going to bring him his money, this same doctor will begin to tone down, will respect this patient, will even behave as if he has no rights, just because he knows that over there you are paid according to the number of patients you attend to. Okay, so that is some of the reasons why humanities as a course is important as a practitioner. So we are going to look at some few terminologies, okay, because we are now going to zoom into the introduction of psychology. So there are some few terms I want you to know it, understand it, so that when I'm mentioning it, you will appreciate it, okay? Right. So there's something we call scientific study. I know most of you might have heard of it, okay? What is scientific study, or the word scientific? Now, anytime you hear the word scientific, you should know that there's something called observation. There's something called investigation. There's something called experimentation, and then analysis. These four activities is what makes something scientific. You observe. You should be able to do a thorough investigation. We do investigation with either our eyes or with whatever thing we want to do with it. Observation. Then you also embark on experiment. You experiment what you think you are seeing to see whether it is what you think it is. So you experiment. You also investigate further. You don't just take it on the face value. No. You dissect it, you break it down to go deeper into the foundation to understand whether what it is showing is indeed what it is. Okay, that's about experimentation or investigation. And then afterwards, you analyze your results. You try to analyze it. You ask questions. You try to compare your answer to another thing. That is what is called analysis. Then after analyzing it, you need to communicate your results to the beneficiaries. Okay. So anytime you hear the word scientific, you should know that there's observation, there's experimentation, there's investigation, and then you analyze your results. Compare it, or you compare it with a hypothesis, okay, or the proposal you put before you to know whether indeed the result you have received from the observation or the investigation indeed is correct or not. Okay, so please know that there's something called scientific study or scientific investigation. Okay, and then we're also going to look at the mind. What is the mind? What is the mind? So the mind is the inner world of thought, feeling, consciousness, and awareness, powered by the physical brains, which acts like its hardware to process information, create memories, solve problems, and imagine things. So essentially, being the non-physical you that experiences and interprets the world. It's the system for thinking, feeling, perceiving, understanding, encompassing both consciousness, conscious actions and unconscious influences, making you aware of yourself and your surrounding. Okay. Now, what is the mind? Now, please, the mind is not the same as the brain. There's a difference between the brain and the mind. The brain is a physical structure in your head. Okay. Encapsulated or housed in the bony structure called the skull. So the brain is the physical structure that you can touch. You can see with the picture. I mean, when you can see, when you talk at the brain, the brain has many parts, blah, 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 blah. So the brain is the physical structure in our head. Okay. Now, this brain does a lot of work. Okay. It processes a lot of information. It processes a lot, it creates a lot of things, memories, it solves problems. Now, these activities of the brain is called the mind. So you can juxtapose this with like a computer. Okay, we have the keypad, we have the monitor, we have the CPU, we have the mouse. So in a computer, or yes, in computing, the monitor or the one that you see things on, the keypad or the keyboard, the CPU and the mouse, we call it the brain. Okay. Now, this computer processes a lot of things. It does a lot of work. Now, the work this computer does for us to see it on the monitor is called the mind, or in computer we call it the software. In psychology, it's the same as the mind. Okay, so please don't forget. Now, so the brain does a lot of things. So as I'm talking now, you are also listening. Okay, now there's a portion of the brains that makes you listen to me and interpret what I'm saying so that you understand it. That is the brain doing its work. Now, when the brain absorbs whatever I'm saying, for you to process it, understand it, so that you can write anything on it, that process the mind goes through to produce the result, it is the mind. Okay, so your feelings, your ability to feel, for the men, sometimes you see a very beautiful lady, you admire this lady, or even those of us who are married, we admire our wives. You see a beautiful car, you wish to get that car. Okay, you see a beautiful dress, a beautiful shoe. That aspect of the brains that makes you do that is the mind, but it's the brain that goes through that process for you to produce that thing called the mind. Okay, all right. So yes, the same thing. So the brain is the physical computer, that's the keyboard, the screen, the wires, and the processor. And the mind is the operating system, the programming that runs through the computer for us to see what we are seeing. Okay, all right. So that is the mind. So please know that there's something called the mind, and the mind is not the brain. Please, there's another terminology I want us to understand: human behavior. Okay, so human behavior is a complex mixture of needs, emotions, learned habits, driven by both internal and external factors, aiming to achieve desirable outcomes, with people often acting on quick emotional response rather than deep logic. So human behavior, all of us here understand what human behavior is. The way we talk, the way we dance, the way we smile. I'm told this is just a joke. A policeman stopped a driver who was actually driving, who has loaded his car with so many things. So he stopped the driver. The driver stopped. The policeman approached the driver, and the first comment from the driver is that from the policeman is Mr. Driver, why have you made your face like that? The answer the driver gave to the police is very, very interesting. The driver told the policeman, please, officer, this is how the face is. I haven't changed. I have not changed my face because you stopped me. This is how my face has been all this while. Okay. If we're to be another driver, maybe that driver could have smiled or laughed. But this guy, he's very serious. So human behavior is just about how we respond to things around us. Okay. So essentially, the way we act, the way we do to get things we want, even if it's just avoiding pain or seeking comfort, influenced by our past and our current situation. Okay. So behavior is how someone acts. So for instance, when I said that at the initial stage, when I said that I'm bringing a rule that if by 6:10 you have not joined the class, you'll not be admitted in. I know some of you, though you didn't speak, may become angry or may become scared. But some of you also, being human as you are, you wanted to make an attempt to try and make a suggestion. Okay? And you see that your plea for mercy, the suggestion from Dr. Ban, and some of you have made me to rescind on that decision. These are human behaviors. Now, if it were to be another lecturer, he will not listen to any of you. He will stand by where he's standing that no, if you don't join the class by 6:10, you will not be admitted in. And whatever you tell him, he'll mind you. Okay? So behaviors changes and they are not the same. Okay? So please know that there's something called human behaviors. Okay? So how a person acts or conducts him or herself in a way include physical, mental, emotional activities. And these are influenced by a variety of factors. Okay? All right. So we will look at what actually drives behaviors. Okay? But not today. Maybe at a later time, we'll be looking at this. Okay? So I'll take maybe 15 minutes to to go into the introduction of psychology, and then so that by 7:40 I will end the class for today to invite questions, because sometimes your question will elicit certain things that maybe I forgot to speak about. Okay, so by 7:40 I will pause and then let you come in. Okay, great. So introduction to psychology. All right. So what is psychology? Don't forget, we've spoken about scientific study. We've also spoken about the mind. We've also spoken about behavior. Okay. So psychology basically is the, so I'm not going to use the word scientific study because I've tried to explain it. Okay. So is the observation, okay, of the human mind and behavior. Okay. How the brain work and how human being also acts. So observing the way the brain works and how human being acts is basically psychology. So like being a detective, for why people think, feel, and act the way they do, using science to understand ourselves, our friends, and the world better, helping us solve problems and become the best version of ourselves. So psychology is about exploring feelings, understanding decisions, and learning how to cope and grow using tools like observation and research. So you see how I've made psychology so simple for you. Okay. So let's say I came to the class today and I say that by 6:10, if you have not joined the class, Mr. Class Rep or the one who created the link, don't admit anybody in. The psychologist will try to understand, why am I coming out with this rule? So the psychologist will try to investigate. So maybe after the class, the psychologist will call me. Naturopath Ross, I know you to be a very lenient person. You are very open-hearted, you are very kind. Why have you decided that after 6:10 you don't allow anybody? Then I'll give you my explanation. So if you realize, I tried to explain why I wanted to come with that rule. Okay. So psychology tried to understand the whys. Okay. Why somebody is doing something, or the behavior, why somebody behaves. So there are some people, even when they are speaking to you in a very calm mood, you hear them shouting. No matter what you do to calm them down, they'll still be shouting. Such a person, don't think that the person doesn't know how to speak. I mean, at a low tone. Yes, it could be because the environment where he was brought up, there was always noise in that environment. So people in that environment used to shout at each other. Shouting doesn't mean they are quarreling. That is how they speak. Okay. Why is it that somebody, anytime he hears bad news, all of a sudden you want to visit the washroom? Could it be that that person, in her upbringing, he was surrounded by bitter experiences, emotional torture, and trauma? So anytime such traumas are coming around, all of a sudden, the system responds by visiting the washroom, either to poo-poo or to wee-wee. Okay, psychologists or psychology will let you understand why your friend is always smiling, even in the face of hurt and anger. He's always smiling. So psychology will let you understand why some people are always smiling, why some people to that at the least thing they become angry. The psychology will let you know why Professor Nyakote Obu, anytime he gives a deadline and some of us appeal to him, he will try to open up and come up again. The psychologist will let you know why he does that. There's a reason to that. And there are two people I want to commend. The class rep, Dr. Emmanuel Ba, and then Lady Zuzu. In fact, as for Lady Zuzu, you are somebody I really admire. When some of you were asking her about your pictures, their graduation pictures, look at the way she responded. With all respect, apologizing to you for the delay. I'm not saying this because Lady Zuzu is on the class, but I would have said it anyway. If we're to be another person, you tell that, oh, Master, I beg you, my computer got locked, so please, when the computer comes, I'll bring it. After all, why every computer can get a problem? Am I the only one who's? I mean, the person will speak in a way that will even make you angry. The psychologists will explain to you why some people speak in a certain way, and why didn't this person also speak in that way. Okay, so as a practitioner, when a patient comes to you, I met a patient who insulted me from head to toe. But with my training and background, all my patients or all my clients who insulted me or who actually, I mean, abused me verbally, they have all become my friends because I didn't react with the way they did. So they realized that, so this guy, after insulting him, he's still smiling and he spoke to me as a professional. Psychologists will let you know why we do the things we do. Okay. So let me see. So the key concepts in the definition of psychology. One, it talks about the mind. So the mind is about what goes on inside your brain, your thoughts, your feelings, your memories, and your emotions. There are some people, with all that I'm saying, they will never forget everything that I said today. So when they even get a slide and they go through once, you give them any question, they will answer you well. But there are some people too, they have to read and read and read and read. The psychologists will tell you that human beings are not the same. Please, am I audible? Can you hear me?
Yes, we can hear
Yes,
you.
sir.
Yes, please.
Yes, sir.
Okay.
We can
Because
hear you.
Good. I've been speaking the last 1 hour and it's as if I'm the only one talking. So yes, I understand. Okay. So the
We
key
can hear
element
you.
good, thank you. The key element in psychology is you should know what the mind does, and you know what human behavior is about, and the science behind studying these things put together. That is all what psychology is about. Okay. So let me also do this. Now, why study psychology? It helps you understand why you get stressed, excited, or angry. Now, when Ghana Black Stars, that is our national football team, when they qualify for the World Cup, I am one of those who are not happy. I am not happy at all. But people were very, very excited, were very happy. And I don't blame them. I am not happy because over the years, when I look at the monies we spend on these people, they spend our money, yet we don't get anything in return. That is why I'm not happy. So I wish that the money should rather be used to do something for the doctors and nurses and teachers, instead of spending monies on this these few people, and yet we don't get any results. The psychologists will try to find out why this. Okay, all right. So It also helps sharpen your social skills. You understand your friends, families, and classmates, improving relationship. Some of you have realized that the course coordinator or prof who puts a notice on the page. They won't read though. When they realize people are commenting on that notice, they are rather going to ask questions on the comment people are making without reading what has been put before. These are human nature. We shouldn't insult such people. We shouldn't become angry. Psychology will let you appreciate the differences in human nature. Okay. Psychology also help you with the problem solving skills. It teaches you to figure out challenges in life and in school. Okay. Making sense of the world. Psychology explains why people behave in groups, why we learn, and how our brain also works. So that is the mind. Okay. So it's that which makes us think, perceive, imagines, remember, and also about our will. Okay. So it covers the totality of mental phenomena, including both conscious process through which an individual is aware of external blah 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 blah. Okay. So in psychology, the mind refers to the intangible. When you say intangible, it's something that exists physically, but you can't touch it. We can't touch our feelings, the way we think, the way we remember things. Our conscious, it's not something that you can hold, like your computer or your pen or your phone, but it exists. That is the mind. Okay. So, and it evolves. It's a product of the brain's physical activity. I think I've explained this. All right. So let me move on. Okay. All right. So I think my time is up. Let me see. All right. So this is an assignment I want to give to us. And then next week, I'm expecting because I'll ask you to explain. So this is the assignment. Discuss therapies that are controlled or influenced by the mind. Discuss therapies that are controlled or influenced by the mind. Then number 2, explore how one of these therapies works to achieve optimal health. Okay. All right. So on this note, I would stop sharing, come back to the class, and then let's see the questions around. Okay, the questions available for me. Okay. I want to believe, did we all enjoy the class?
Yes,
Hello?
Yeah, we
yes,
did
Doc.
enjoy
Yes,
it
sir.
very much.
Very much.
Very much, sir.
Okay.
Yes, sir.
So,
Yes, sir.
yes.
Yes, sir.
Yes, please. We
Good.
enjoy very much.
Good. In fact, we have a lot of things in store. So as you join the class, you are really going to enjoy yourself. Okay. So now question time. Let me look at um, Madam Ingrid. Johannes. Madam Ingrid.
Yes, thank you so much. I really appreciate the class. It was very well. You present very, very well, and I appreciate it. Thank you. And I know I speak for the rest of us. We feel the same. Now, you brought up a subject. Well, a top. You brought up something that I actually thought about before, but I kept quiet about it. But since you brought it up again, um, I thought, let me say something. Where you said it's good to speak out and not just keep quiet about things. But um, sometimes good thinking people uh, keep quiet and allow things that are not good to continue. And it's something I also feel very passionate about. Now, what I have in mind by saying this is that there's something I consider what let's call it um, colonial health, colonial health um, let me yeah colonial health practices. And what I mean by that is that um, some of the um, forces that control us impose things on us, not just financially and physically, but health wise, aspects um, of health that they introduce into various countries and societies that do affect us negatively. And it's not that we don't know, we know. As a people, we know. And but because the leadership or those in control have the say over you or on behalf of the rest of the population, certain things are introduced into the society that's not good for us. I didn't really want to bring this up before in previous classes, but because I thought, it's controversial, and I don't want to get into to be marked as that woman that is bringing up these things. But since you brought up the thing about keeping quiet this today, I thought I would raise it because it's something I really do feel passionate about. And there are things that are introduced into our society that has been negatively affecting us or have in the past affected us. And I can't help but wonder sometimes, where are the professionals? Where are the scientists? Where are the doctors? So I'll just leave it at that for now. Thank you.
Okay, thank you. So you can bring down your hand, Madam Ingrid. All right, so let me try to understand